Sir, how is Bombay treating you now?
Yeah, it's been close to a month now. Settled down. Alembic is a great organization to work, and I got my residence close to this place, so hardly takes me 20 minutes.
That's a boon.
Yeah, in Bombay.
Especially in
that
Bombay.
it is. Absolutely.
So I hope you settle down completely now.
Absolutely, very well. The family is here. We're all set to go.
Nice. Sir, finding you here gives me an opportunity of asking you some questions which have been bothering me for quite some time.
Please go ahead, Richa.
Sir, anti-infective and respiratory therapy. Now, I'm just not able to understand what's going on with the therapies. Last 2-3 quarters, we see these are the two therapy areas that are driving the entire market, especially with the
Absolutely.
robust double-digit growth. Why?
I think we'll need to reflect back and go into history around 18 months back, Richa. If you look at, the last year, we feel that the markets had degrown in the first 2 quarters, but that was not a degrowth. It was correction of the exorbitant growth that these anti-infectives saw way back in 2021 when COVID hit us. Right? The usage of anti-infectives was multiplied. Those brands which were available and really benefited, and it's to that period when we see there was that degrowth. Now similarly, past 4-5 months, there are two reasons. Number one, as compared to the base that we had in the last year, where January was the last COVID month and there were huge stocks piled up at the stockists, that continued for a couple of quarters rather. That's the reason the degrowth was observed. Now to that base, when you see a usage, you're seeing a healthy growth. Moreover, in the past 2-3 months, if you look at the kind of fever that's coming in, they term it as acute febrile illness or the viral fevers, they need actually more than one antibiotic. Rather, most of us have to take at least 2 antibiotics, not for 5 days, even for 10-12 days. And that's giving the treatment. I think most of the pharma industry people, all of us, could not calibrate in the last financial year what would happen to the anti-infective.
Right.
And because the high closing stock and the usage that people had earlier, first few months was a lull. However, all said and done, I can only tell you that at least top 5 brands of each anti-infective in the RPM, right, have benefited during the COVID period. The prescriber base has expanded, and most of the organizations had this opportunity to engage with those doctors and give them more reasons to prescribe an anti-infective. Yeah? That's one of the reasons, and I think the top 2-3 brands which have actually gained in the last 1 year have consciously worked on demand generation. They worked on creating or educating the doctors on the newer indications. And I think any company which worked on both the engines, which is demand generation and demand fulfillment, has benefited. That's for sure.
Does this also mean that companies have very consciously started meeting GPs and educating them on the usage of antibiotics?
Absolutely. I think a lot of credit that I give to the condition of India during the COVID period is to GPs and also to maybe the retailers here. I think during COVID period, as compared to the other countries in the Western world, why we didn't have as many casualties, because I think the IMA, API and all the state bodies also worked on educating one of the treatment, regime to the GPs as well as to the retailers, and that's how most of us benefited.
Right. So does this also mean the adherence to therapy is now being corrected?
Could be, and also could be that the GPs are becoming more educated in terms of the usage, and bodies like AP and IMA have created guidelines on the treatment of febrile illness, on the treatment of various other therapy areas, and that is helping us educate. You're right.
Right. So thank you. This insight really helps me. Let me take you through our office, give you a guided tour on how we have set up ourselves.
Sure, it's
Please
all
come.
yours. Yeah, Richa, a wonderful office.
Thank you so much, sir. Sir, you have seen this industry evolve in the various functions that you have worked with the organizations. You have seen how the marketing strategies have changed for the companies. We see a lot of companies now moving towards pricing penetration strategy. They want to bring in prices as low as possible. What are your thoughts on this? And then I'll add why am I asking this question to you.
Sure, you can do that, but I don't know, my experience has been that price is not the sole differentiator ever. However, all said and done, at least for chronic therapies, it may matter, right? Because today, with the e-commerce websites coming in, the patients and the doctors have to be, so the doctors have to be a little careful because the patients have become smarter. They can actually check what product is being prescribed to them. Google is the world. E-commerce websites tell them which is a cheaper option and the other things. But still, I think for healthcare, people are ready to spend a decent amount. And I think, like you rightly said, in today's world, there are no major differences in the strategy. All the strategies are copied by most of the companies in the next few weeks, not to talk about months, right? And yeah, price is important, but neither can you be an outlier in terms of being very expensive, right? Because of what I was talking about. And nor do people want to be perceived as very cheap, right? So you have to be in that price band, which you call as average price band. And even when it comes to new products that come in, I think it's a matter of a few weeks or the months. You see all the top 20 companies joining the bandwagon. Any gliptin that you've seen in the past or any new product that has come in any therapy, right? So prices, more or less, that I'm seeing are in that price band, right? When it comes to the doctor, I think doctors have also realized that it's the right quality for their patient which matters. Doctors have also realized that companies which bring in maybe patient-centric activities and, of course, have the reputation of a quality product are the ones which are going to benefit.
Right, right.
But you were telling me something else.
So my reason of asking this question was that if I am decreasing my price, I'm getting into a penetrative pricing strategy, I am in a way eroding my profits. My bottom lines are getting impacted. How am I going to take care of the expenses that the fixed expenses that I have as a company? The medical reps need their increments. The expenses in terms of the DAs are going up. How do I take care of all those things and still be profitable?
So like I told you, maybe it's something to do with, if you're talking about the P&L and the profitability, the organizations have also realized that there are various means of, trying to curb the other expenses which can be reduced. Similarly, on the API cost, during COVID, the API costs had shot up. I think now the API costs of most of the products are stabilizing. There are wastages which organizations are realizing and trying to correct, right? However, it's that patient centricity which importantly is the piece and we need to look at. Similarly, when it comes to marketing expenses as well, I think most of us are now utilizing our expenses on engaging with the doctors and helping them treat their patient in a better way, engage with their patient to give him a better lifestyle. And hence, the expenses of marketing are becoming more rational.
This, sir, also makes me think about how are we getting impacted as an industry by the regulation the government is bringing in.
The regulations, you mean to say acts like 194R
Exactly.
or the others?
Yes.
All right. So I can only tell you that I think I'm very happy about that the regulatory bodies have started aping the West. Right? So the quality controls in terms of even the products that are being approved and the acts that are coming in are making the industry and the HCPs more conscious about the ways and means how we operate. So 194R again is a boon for those organizations who were already working on maybe having patient-centric activities. Over the years, the HCPs and the industry both have observed that the only differentiator going forward is going to be the right quality, right engagement activities, and your people. So the more you work on people capabilities, the more you work on better interaction with your customers, the better will be your long-term perspectives. So I think very happy about the regulatory bodies bringing in something like this.
Right. Will this also help us getting into extra urban markets more easily?
Extra urban, I think way back in early 2000s, there were maybe the McKinseys of the world who were coming and saying the gold mine lies in the bottom of the pyramid. I think this is the time many organizations experimented, failed, retried, and are now trying to once again get on to the bottom of the pyramid. Yes, in extra-urban also, with digitalization improving, they are also coming more closer to what is happening in the metros and the semi-metros. There are doctors who are understanding. There are those hub chemists which are also helping in better patient treatment profiles. And hence, yes, I think most of the top 20 companies are now getting into the extra-urban way. And that may be one of the growth drivers in the industry in the next couple of years.
Right. So thank you so much. This has truly helped me answer a few of the questions that I had for a few months now. And I'm sure under your able guidance, Alembic will certainly be doing extremely well. Thank you so much, sir. Also, thank you to our audience for joining us today morning. Have a lovely day ahead.